New here at 6, the I-Team found the federal government has cited just 4 workplaces in Florida for coronavirus-related safety violations. This as cases rise, thousands of complaints pour in, and critics tell our I-Team investigator Kylie McGivern those on the front line still don't have the protections they need.
It's an October evening, the sun beginning to set, when we meet nurse Judy Pruce before she heads into her overnight shift.
In the ICU.
The same shift she's worked for 15 years at Oak Hill Hospital in Brooksville.
I enjoy my job. I enjoy taking care of patients, but it has been very scary. We're still struggling with PPE.
Personal protective equipment like masks to protect against the coronavirus.
The sports teams seem to have unlimited testing, unlimited whatever they need, but then the nurses who are working every day with these patients and being exposed can't get the equipment and can't get the testing that we need.
Oak Hill Hospital is part of HCA Healthcare, a network of 186 hospitals across the country. HCA is at the center of an Occupational Safety and Health Administration complaint Pruce's union filed in August. The National Nurses United complaint names more than a dozen HCA medical centers and hospitals, including Oak Hill Hospital, along with 6 other Tampa Bay area facilities. The complaint accuses HCA of failing to notify or test all asymptomatic workers when they have been exposed to COVID-19 by their patients or coworkers, saying the frontline workers are in imminent danger of serious physical harm or even death.
Now we have nurses who have been working with the patients who have now been exposed, and they're not always notified.
OSHA requires employers to provide a workplace free from recognized hazards that are causing or are likely to cause death or serious physical harm to employees.
If we're going to be around sick COVID people all the time, we need more testing.
HCA fired back, saying National Nurses United has chosen this pandemic as an opportunity to gain publicity by attacking hospitals across the country. In an email to the I-Team, a spokesperson wrote, "Our focus at Oak Hill Hospital has been to protect our caregivers. Efforts have included screening and testing, universal masking, contact tracing, and notification, in line with guidance from the CDC, saying we're proud of our response." OSHA has not cited the hospital, but the I-Team found as of the end of October, 179 workplaces across the country did receive coronavirus-related citations after inspection. This, as more than 11,000 complaints and referrals have poured into the agency, around 500 of them from Florida. Do you think that workers are being protected the way that they should right now in this pandemic?
Sadly not.
David Michaels, now a professor, was the longest-serving head of OSHA until he stepped down in 2017.
OSHA, the agency I used to run, really has been missing in action. We've had hundreds of thousands of workers who have been infected and many hundreds who have died.
An I-Team review revealed since the start of the pandemic, OSHA has cited 4 employers in Florida. Braden River Rehabilitation Center is one of them. The facility made headlines in April when it and another nursing home owned by the same company accounted for 141 positive COVID-19 cases in residents and staff and 23 deaths.
If you give workers an N95 respirator, you have to make sure it fits. But there's no requirement that says you have to give them an N95 respirator. OSHA just has to rely on the old tools it has, and that's like working with both hands tied behind your back.
It's illegal for an employer to retaliate against a worker for filing a complaint with OSHA. But OSHA's former leader advises, don't raise concerns alone. Get with a union.
You're much stronger.
Unions like United Healthcare Workers East.
It is a daily struggle.
The nation's largest healthcare union represents more than 24,000 Florida healthcare workers, many who Vice President Bob Gibson says are still in need of PPE.
We've been told that this is something that's going to be handled by the state. Then the state says that this is something that's going to be handled by OSHA or the feds. We shouldn't be dealing with this 7 months in. We need to make sure that these companies, these corporations are held accountable.
After our repeated requests, OSHA denied an on-camera interview and the opportunity to tell the public what it is doing to protect workers. Instead, a spokesperson wrote in an email, OSHA has been working around the clock and has up to 6 months to complete an inspection. The statement goes on to say OSHA investigates every complaint and will take the steps needed to address unsafe workplaces, prioritizing COVID-19 inspections. But as Bruce prepares to start her shift, the glow of the hospital lights illuminates what she says is a daily fear.
It's what I do. I'm a nurse. I don't want to be treated like a sacrificial lamb.
So far, the Department of Labor tells the I-Team it's received 18 COVID-19 related complaints from Tampa alone. If you want to add your voice to that growing list, we've included information on our website so you can submit a confidential complaint. That's abcactionnews.com. And there, you'll also find a database where you can look up facilities in your area to see who is facing PPE shortages. I'm I-Team investigator Kylie McGivern, taking action for you.